Okay. Sometimes I tend to talk fast. If I start talking fast, just wave me down and I'll slow down. All right, so we're going to do a little health talk about diabetes. This is a good talk just for educational purposes, even if you have diabetes. If you don't, need a little louder. How's that? Better? Too much now? Okay, sorry. We're going to just go over diabetes, kind of the pathophysiology behind it, how to prevent it if you don't have it, and then if you do have it, some strategies you can do to kind of manage it. I'm sure if you do have it, a lot of your physicians are on top of it with your, medications and your diet, but it's always good, just a little refresher, a little reminder. So, and I'll try to remember the clicker today. Last time I went through like 5 slides without clicking forward, so if I'm not matching up, just let me know. So the overview, we're just going to go over what is diabetes, understanding the diagnosis of diabetes, and then just how to live, as a person with diabetes, how to manage it and live as much of a normal life as possible. So the goals is to be in control, so you want to manage your diabetes, you don't want your diabetes to kind of manage you. Some lessons about eating correctly with diabetes, and then just know when to see your physician. There's some symptoms either leading up to, if you don't have a diagnosis, or that if you have the diagnosis of diabetes, some things where you should contact your physician if you're starting to notice things. So we just want to go over that to make sure you're aware of all those. So first we're just going to go over what is diabetes. So most everyone just calls it diabetes, but the full term is diabetes mellitus, and it refers to a group of diseases that affect how your body uses your blood sugar. So then that's your glucose. Now, glucose is vital to your health because it is an important source of energy for the cells that make up your muscles and your tissues. So, diabetes can affect all different muscles, different groups, different organs and systems of the body. It's also your brain's main source of fuel. So, that's why some people that have low blood sugar, they can feel a little delirious or out of it, because it is your source of fuel for your brain. So it's a chronic, lifelong disease. So once you have, you can manage it. You can get your blood sugars under control, but it is something that you usually have to deal with kind of ongoing once you are diagnosed. So it occurs when the pancreas does not produce enough insulin to properly control the blood sugar levels. We'll go through the differences between type 1 and type 2 and how that differently affects the pancreas and your blood glucose levels. But it's usually marked by high levels of sugar in the blood. So that's usually how it's detected. If you start having some of these signs and symptoms, or if you have some of the risk factors of diabetes, like being overweight, being a certain age, having a family history, they'll do a blood test, and usually it's fasting. They'll, because different meals can spike your blood glucose or change the level. So usually when they test for it, they'll do a fasting blood glucose where you go in to the doctors, get your blood work before you eat anything, and then you really see what your level's like. So if the levels are high, that usually leads to a diabetes diagnosis. And there's 2 types, type 1 and type 2, and we'll go through those now, what those are. So type 1 diabetes, that's more of the genetic, you're born with it type diabetes. So it's not so much lifestyle as it is just something you're either born with or develop usually as a child. Has anyone heard the term juvenile diabetes? So yeah, that's what this is. It's basically because it is usually diagnosed in children or young adults. So this is when the body does not produce insulin at all. So insulin is the hormone that is needed to convert sugar, starches, and other food into the energy needed for daily life. So when it doesn't produce insulin, you need something else to do that for you. So usually when you're diagnosed with type 1 diabetes, you have to take insulin every day, and you should have a little bit more structure with your diet. So you try to eat meals at the same time. You should try to be consistent with the type of food you consume, and then you should with your physician, establish an exercise routine. So most of the time that's diagnosed in like children or young, before adulthood. So if you haven't been diagnosed with type 1 diabetes, I wouldn't worry about getting it, but you might have family members, grandchildren that might be dealing with it. So it's good to know and see just see the signs and symptoms. So the diagram over here is just showing what happens with type 1 diabetes. So 1 is at the top there. The stomach changes food into glucose. So as you eat it, the stomach changes the food into glucose. Then glucose enters the bloodstream. And then with type 1 diabetes, the pancreas makes little to no insulin. So that's that number 3 picture, that little like yellow greenish buildup there. So then what happens is there's little to no insulin enters the bloodstream, and then glucose builds up in the bloodstream. So that's why you need the insulin to kind of regulate that glucose. So that's what happens with type 1 diabetes. So type 2 diabetes, that's more of the, it's the more common type. It's more of the lifestyle diabetes. So it's more when if you don't eat correctly or overweight. So that's usually how that develops. That's why it's more common. So this one, in type 1 diabetes, the body doesn't create insulin. In type 2 diabetes, it does not use insulin properly. So it makes it just doesn't use it properly. That's what they call insulin resistance. It used to be called previously non-insulin dependent, but they came up with a better term to better describe it, which was insulin resistance. So in this situation, the pancreas makes extra insulin to make up for the insulin resistance. And then what happens is over time, the pancreas is unable to keep up with that, and it cannot make enough insulin to keep your blood glucose at normal levels. That's why people with type 2 diabetes eventually might have to start using insulin pens or take insulin. So the most common treatment is reaching and maintaining a healthy body weight. So that helps, with this insulin resistance if you have a maintained body weight. And usually that's how the type 2 diabetes starts, is if like bad diet or overweight. So, that's the way you get it. And then coming back to a healthy body weight helps manage it. And then also medication can be prescribed to lower blood glucose levels. So the insulin or some other medications can be used for that. So this diagram, same thing, the stomach changes the food into glucose, the glucose enters the bloodstream, but this one, number 3, the pancreas is able to make insulin, and insulin does enter the bloodstream, but the glucose can't get into the cells of the body, and that builds up in the blood vessels. So kind of same issues you get with type 1 and type 2, just a little bit different mechanism of the disease there. So the symptoms, for type 1 is extreme thirst or hunger, frequent urination, weight loss, unexplained weight loss. So if you're just losing weight when you're not trying to lose weight, blurred vision or dizziness, low energy or fatigue, and genital itching. So these symptoms occur when the blood glucose is high. So you might get that high sugar in your blood, and then you start getting some of these symptoms. So again, these would be seen more in the younger adults, children, because that's usually when type 1 is found. So, if you have any relatives or grandchildren that might be experiencing some of this, you might want to suggest them getting checked out for that. So type 2 diabetes, similar type symptoms. They have extreme thirst, which is similar to type 1, fatigue, again, the frequent urination and the itching. Frequent infections are common, so UTI, vaginal infection, boils, or abscess. And then the weight changes with type 2 can be gain or loss. So if you gain a bunch of weight for unexplained reasons, or if you lose, same thing, if you lose a bunch of weight when you're not trying, these can all be signs of type 2 diabetes. So if you notice any of these symptoms, it's always good to get checked by the doctor, let them know about it. Sometimes you don't even feel the symptoms, or the symptoms occur over a long period of time, so you might not really think much of it, but it could be found on a routine medical checkup. So a lot of times doctors they'll run a fasting blood test every so often, so that sometimes you might not even have any of these symptoms, and they'll see that your blood sugar is a little high. So if you're having the symptoms, get them checked. And if the doctor recommends like routine blood work, it's good to keep up on that, because sometimes you may not even notice that you're having the symptoms. So prevention and screening. So currently there's no way to prevent or screen type 1 diabetes. So that's like the juvenile diabetes that occurs in young adults. So because there's no cure, there's no way to prevent it, it's not necessarily maintaining a healthy weight. It just kind of happens genetically. So unfortunately, there's no way to kind of prevent or screen for that. Excuse me. So type 2 diabetes, you want to screen, is recommended for children that are overweight and have other risk factors for diabetes, such as genetics, family history of it. And they start at age 10 and repeat every couple years. And also for overweight adults, so BMI greater than 25 who have other risk factors. So same thing. The BMI is body mass index. That's when you take your height and your weight and it spits out a number. And that, there's calculators for that, and the doctors that's why they check your height and weight when you go to the doctor. So sometimes there's other factors, like if someone has extra muscle or something that might make the BMI higher, even if they have a higher weight. But usually it's a pretty good indicator if it's way high or way low that something's wrong. So it's a good easy screening tool with the weight and the height is easy enough to take. But then adults over 45 every 3 years, even if they don't have symptoms, it's good to get that blood work taken. So more prevention. So you want to maintain healthy weight or lose weight if you're overweight. So there's one large study that found that people reduce their risk of developing diabetes by almost 60% just by losing approximately 7% of their body weight with changes in diet, exercise. So a little reduction in weight gives a lot of protection against diabetes. So that was a pretty interesting finding there. So some ways to do this and to prevent it is be physically active. So aerobic exercise 30 minutes per day, resistance training at least 2 to 3 times per week, and then reduce inactivity. So even if you're not actively exercising, you may be taking the stairs if you feel up to meals, or just taking like a walk around the building. Just simple things like that. If you were the last month health talk, we went through some fitness, fitness ideas. So there's different things you can do. Even like leisurely activities, going outside when it's nice. All those things reduce inactivity and help prevent these kind of illnesses. And then healthy eating. So fruits, non-starchy vegetables, and whole grains are good. So some of the starchy vegetables are like the potatoes, corn. They're good for you, but in heavy doses, they can lead to excess weight. So those non-starchy vegetables. And then just making better choices with food. Not some of these like fad diets, you want to get on, and they're not really sustainable, like the no carb, not eating any carbs, or eating only certain foods. Some of them are not sustainable. So just making better choices in your daily life, is better for maintaining healthy weight than trying to lose a bunch all at once. It's more easier to stick to. So fiber-rich foods are good for preventing diabetes for a couple of reasons. One, they slow the absorption of sugars. They help lower blood sugar levels. They interfere with the absorption of fat and cholesterol. They manage some of the other risk factors that affect your heart health, such as high blood pressure and inflammation. So if you have diabetes or at risk for it, high blood pressure and inflammation are just things that aren't good to have along with it. So that's important. And then it just simply helps you eat less because fiber-rich foods are more filling and energy-rich. So eat a breakfast high in fiber. That's going to fill you up more. You won't go back for that mid-after. It might last you till lunch instead of going for that mid-morning snack or something. So now we're going to go through some of the complications if you do have diabetes. So let's see. One of them is the diabetic foot. So diabetes can cause damage to the blood vessels and nerves, and that can cause foot problems called neuropathy. So some of the symptoms of neuropathy include tingling, numbness, pain, burning, weakness, loss of sensation, ulcers, deformity, callus, and poor blood flow, which can result in non-healing wounds. So it's important for people with diabetes to kind of inspect their foot, make sure that they're noticing any wounds or anything like that, just because that can affect it. You might have heard of it's called stocking glove. So a lot of people with diabetes, that's how they notice that they have numbness and tingling in their hands and feet. So it kind of skips the arm, skips the leg, and goes right to the hands and feet. So if you ever notice any tingling in your hands and feet, it'd be something good to get checked. So some foot care tips. So to prevent problems with the feet, you should stop smoking. That's important for a lot of aspects with diabetes. If you're a smoker and have diabetes, that just puts you at more risk for a lot of the other issues that can come along with it. Just improving the control of your blood sugar, so kind of maintaining that healthy blood sugar levels are good to maintain good foot health. And just getting a proper exam by a healthcare provider and learn whether or not you have any damage. So, the doctor can get like a baseline, give you some tips to kind of manage it, and then he can teach you how to inspect your feet, know what to look for, and when to contact them. And then wearing the proper kinds of shoes. So there are specific diabetic shoes. I think usually you can get like a pair a year with insurance if you're diagnosed with diabetes. So just wearing stuff that's not putting too much pressure, especially if you have, loss of sensation. Some of those shoes with we had someone that had the Crocs and has a really hard plastic piece on it. And if you don't have sensation, you're putting pressure on it and it's making a little wound without you even noticing. So a lot of the the diabetic shoes kind of, have proper padding and stuff to prevent any kind of things like that happening. Excuse me. So there's more serious problems that can occur with the eyes, kidneys, nerves, heart, blood vessels, and other areas with diabetes. The risk of heart attack is the same as someone who has already had a heart attack. So if you had a heart attack, you're more at risk of getting another one. Someone with diabetes, even if they haven't had a heart attack in the past, they're at the same risk as someone has already previously had one. So your heart's just in a little bit more vulnerable position with diabetes. And some general complications include high blood pressure, damage to blood vessels that supply the legs and feet. That's why you lose some of that sensation. Stroke, high cholesterol, and nerve damage. So that's the diabetic neuropathy that can cause that, the hands and feet issues. There's also some vision issues that can happen. So cataracts, glaucoma, macular edema, which is just worsening of the eyesight, kidney disease and kidney failure, and we already kind of touched on the foot sores and ulcers, which in extreme cases can result in amputation if they have these chronic wounds that just never heal, or if the wound gets infected, it can lead to, them needing to remove, a toe or possibly the whole foot or below the knee. So those are more extreme cases, but, something that can happen. Just different skin issues, fungal, itching and different things. There's styes, boils, infections in the nail. So the skin can be affected as well with diabetes. So the kidneys, there's lower risk if sugar and blood pressure are controls, but if you're, have these high spikes in blood pressure, real low blood pressure, your kidneys can be damaged and, potentially need for dialysis or some kind of kidney treatment. Stroke, the risk of stroke is 1.5 times higher in diabetes and non. The eyes, there's 40% more risk of glaucoma and 60% more risk of cataracts. And then there's diabetic retinopathy, which is issues with the retina of the eye. And that's also increased risk there as well. So there's gastroparesis as well, when there's delay in the stomach emptying due to nerve damage. So some of the symptoms of that could be heartburn, nausea, if you vomit and the food is undigested, early feeling of fullness when eating, weight loss, bloating, erratic blood sugar levels, a lack of appetite because you already feel full, and then acid reflux and spasm on the stomach wall. So there's just some things some of the stomach things to look for that could be a sign of more serious issues. So diabetic ketoacidosis is a serious condition that can lead to diabetic coma or even death. So this happens when your cells do not get the glucose they need or for energy because the body has little to no insulin. Your body begins to burn fat for energy, which produces ketones, which are acids that build up in the blood and appear in the urine when your body does not have enough insulin. Ketones are a warning sign that your diabetes is out of control and that you're getting very sick. So that's usually with someone that's either their blood sugar's way out of control, or if they haven't taken their insulin properly because they need the insulin to kind of help the body use that glucose. So if this is more of a serious complication than just your normal things. It's more of an emergent need. So early symptoms include thirst or a very dry mouth, frequent urination, high levels of blood glucose levels, or high levels of ketones in the urine. Then you could be constantly feeling tired or lethargic, having dry or flushed skin, nausea, vomiting, abdominal pain, difficulty breathing, fruity odor on the breath, and a hard time paying attention or confusion. So the diabetic ketoacidosis is a serious condition. So if you have any of these symptoms, it's something you'd want to contact, your physician right away about, or go to the nearest emergency room or hospital. So I think most of these things, you would obviously see some of the stuff you might not notice, like a frequent urination or thirsty, but some of these other ones, the key is to kind of know your body, know if something feels off, and you might want to, you want to contact your physician right away if you're noticing any changes to urination, your feeling of your throat, anything like that. So now we've gone through some of the scarier stuff, but now how do you manage diabetes if you do have it? We talked about prevention, but if you already have it, there's ways to manage it where it doesn't, affect your life, or you don't get any of these bad side effects that can occur. So some education about it is good. Talk about diet, meal planning, exercise, medication. Testing your glucose is important to make sure that it's at the proper levels. Podiatry, we already talked about the complications that can occur with the foot, so making sure the feet are okay. Frequent labs, so based off your doctor's recommendation, how often you should get your blood checked and different things, urine checked. Recognizing the symptoms and have an emergency plan if you do have kind of an emergent episode, what to do. So you want to successfully manage diabetes by making healthy food choices. You might want to speak to your physician first, just to make sure they're on the same page with what you should be eating. There's also dietitians and nutritionists that specialize specific in helping diabetic patients. So that could be something that your doctor could recommend as well. And then you just want to make sure you follow those orders. So, it's important that they know if you're changing your diet at all, or if you're not able to stick to it for whatever reason, you want to communicate that with the doctor. Knowing your sugar level. So that's important. So you want to the doctor, they have different things now. They have the finger prick things where you test your blood. They have ones now where it's already implanted and you just kind of scan it. So there's a lot of things now where you can check your blood sugar levels. So they'll help you set a goal for what your level should be during the day, and then the glucometer is that machine right there. So it's the finger stick, and I think they have some fancier ones now. I have a family member who has one he has something in his arm and he just waves something over it and it gives a rating. So it's probably less cumbersome than having to stick your finger every few hours. So the American Diabetes Association recommends keeping the blood sugar levels in the range of 80 to 20 milligrams before meals and 100 to 140 at bedtime. So it's important to test them, because if you're, low or you're high, and you can let your physician know, you might not get those symptoms right away if you're out of this range. But if you're consistently, at 180 or 200, you might not have any of these symptoms, but it's something that the doctor should know, and they might have to adjust your insulin levels or your medication levels. So that's why self-testing is important, so you get kind of see if there's any issues before you get to that point of having needing to call the doctor or needing to call an ambulance. So that's why it's important to self-test. So treating low blood sugar, so that's when hypoglycemia can develop quickly in people with diabetes. So that's when your blood sugar drops low. If the level is low or you have symptoms of hypoglycemia, you should eat something with sugar. So it could be something easy, like the orange juice is common to drink, like a piece of fruit, a piece of hard candy is good. So if you do have diabetes or low blood sugar, I would just keep some of that stuff on hand. This way you can kind of pop it in if you do notice having those symptoms, or if you check it and you're low. When your blood sugar is in a safer range, you may need to eat a snack with carbohydrates and proteins, such as cheese and crackers or a glass of milk. And then you can ask your physician if you need an injection kit to raise your blood sugar quickly in an emergency. So that would be something your physician would prescribe you with. But sometimes if your blood level drops too low, that little piece of hard candy might not do the trick. You might need something more potent. But it's good to have have a plan in place in case you do need something. If your blood sugar drops, have something that you can have to kind of raise it up a little bit and get you feeling okay. So treating high blood sugar, that's when the diabetic ketoacidosis comes into play, that thing we talked about earlier, that emergent situation. So that occurs when the body cannot use sugar as a fuel source because the body has no insulin or not enough insulin. So it uses your fat stores for energy. So the goal of treatment is to correct the high blood glucose by giving it more insulin. If it's very severe, you may need to go to the hospital. So that's when your doctor will have a plan in place. If you check your blood sugar and it's high, he'll tell you to take this much insulin, or things like that. It's not as easy as taking eating a piece of candy or fruit. You need insulin, and the doctor will have a plan in place to let you know of what you should do if you do experience that. So the treatment goals, if you do get that, is to treat the ketoacidosis and the high glucose levels. So it's important to get that under control as quickly as possible. And then that's for type 1. And then for type 2, you want to regulate your blood glucose levels, and the primary treatment is diet and exercise. So Sometimes you can manage your with type 2, you can manage that diabetes with just maintaining a healthy weight, eating proper fruits, vegetables, proper diet. Whereas type 1, because your body doesn't make any insulin at all, you usually need that insulin treatment. So when to call your physician or 911, we kind of touched on this a little bit, but if you're experiencing any chest pain or pressure, shortness of breath, or other signs of angina or chest pain, loss of consciousness, obviously you won't be able to call, but someone will call for you if you lose consciousness, or if you do like faint and wake up, you'd want to contact your doctor or the ambulance right away. Any seizures, if you need to take deep, rapid breaths, you're not able to catch your breath with normal breathing. Extreme thirst and frequent drinking/urination. Severe nausea or vomiting and inability to drink liquids or eat. Sweet smelling breath, we talked about that fruit smelling breath earlier. And any shortness of breath or confusion. So all these are signs that something might be off and not going on. So some of them, if something just doesn't feel right, you might want to call the doctor, see what they say. If it's something more serious where you can't catch your breath or you're very confused or feel like you're going to pass out, that's something where you might want to contact the 911 or go to the emergency room. Some more things. Severe abdominal pain, high blood glucose or ketone levels in your urine. Obviously, you wouldn't be able to check the urine, but if you have your high blood glucose, like the high blood sugar, you'd be able to tell that. Symptoms that your blood sugar is getting too low, so that's that feeling faint, not maybe a little bit of confusion. Numbness, tingling, pain in your hands and feet. Any sores or infections in your feet, you want to call the doctor about, and any changes in your vision, you want to contact a physician. That's all I have. Does anyone have any questions or comments or anything? Yes.
Can diabetes 2 change to diabetes 1?
So I don't believe So I think type 1 you can it can turn into with a bad diet you can have some of the symptoms of diabetes 2, but type 2 diabetes won't flip back into diabetes 1. I don't believe that happens. So, but anytime, some of the things that cause diabetes 2, like say you have type 1 and you don't have a healthy weight, and you can also develop some issues with that too. So, won't revert, like if you have type 2, you weren't born, you don't have type 1, it won't revert back to that. But if you have type 1, you could get some of the symptoms of the type 2 by not managing your weight and diet properly.
If you're eating a lot of sugary food, can it change to diabetes 2?
Yeah, you definitely have some issues, but you're still your body's still not gonna. So with type 1, your body doesn't produce insulin, so you're still gonna have that. That's what's classified as type 1. So even if you do eat a lot of sugar, you might have some of the issues that come along with type 2. But with type 2, you're insulin resistant, whereas type 1, you don't make any insulin. So it's still gonna have that not producing insulin of type 1. That's the main classification of it. I think with type 2, I don't think there's necessarily a cure. It can be managed. So, if you get to a healthy weight, then you'd be able to test your blood sugar levels and stuff. You might be able to stop taking the insulin if it's type 2, and if you get to your blood sugar levels. But I think there's always that, you always have to be tested and kind of keep an eye on it. Type 1, there's no cure, so you're always going to have to take insulin for now. But type 2, I think you get to your body to a level where you won't have to necessarily take insulin if you get that weight and blood sugars under control, but it's still something you're always going to have to you won't be able to just forget it that you had it, not like.
Would you ever have to stop taking medication?
I think there's some if they get to a healthy enough point, they can stop taking insulin or medication, but it's on a case-by-case basis. I think it's, it's difficult to get to that point, but it's possible. But, yeah. Anyone else? All right. I have a little handout here just with some of the points that we summarized. If I can pass them out if you like them. And then, we'll be here back next month. We'll think of a good topic. If anyone has any suggestions, let me know. But, we'll do this again next month. Yeah. Thank you.